Good morning, everyone. I think we're ready to begin with the next witness, Mr. Duncan.
That's correct, my lord. Denise Gallagher will be our next witness.
Thank you. Good morning, Mrs. Gallagher.
Morning.
As you are aware, you're about to be asked questions by Mr. Duncan. I think you've had the opportunity to meet him at least on screen.
Yes,
if we now have him in person. We will probably take a coffee break at about 11:30. But should you wish to take a break before that, just give me an indication and we'll take a break. I think you're prepared to take the oath. I'd ask you, just sitting where you are, to raise your right hand. That's a very common situation. And repeat these words after me. I swear by Almighty God.
I swear by Almighty God.
That I will tell the truth.
That I will tell the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the
Thank
truth.
you very much, Mrs. Gallagher. Now, Mr. Duncan.
Thank you, my lord. Good morning again, Mrs. Gallagher. Can I just begin with some formal questions, and can I have you confirm that you are Denise Gallagher and that you live with your husband and your 2 children in North Lanarkshire?
That's correct.
And without telling me where you work, could you tell us what line of work you are in?
So I'm an advanced nurse practitioner. So I work with GPs assessing patients, coming to clinical diagnoses and prescribing treatments, and onward referral to specialist services.
Mm-hmm. And how long have you done that?
So I've been an advanced nurse practitioner since 2018. Before then I worked as a senior staff nurse in an accident emergency department.
Mm-hmm. So, all told, how long have you been in nursing?
I've been in nursing since 2002. That's when I qualified. About 19, 20 years.
And have you got any areas of specialism that you've worked in over the years?
I would probably say I've worked in emergency medicine for the bulk of my career, and now in my job I probably would say it's urgent care presentations, mostly dealing with children or older people, and the spectrum in between.
What experience over all of that have you in dealing with or having to be aware of issues to do with control of infection?
Every aspect of my job is about control of infection, and even in emergency nursing, control infections, because you could have respiratory infectious diseases. So yeah, you have to be quite acutely aware of control standards.
Thank you. Now, I think we know that you're here today to give evidence about the elder of your 2 children, your son, and he is presently 11 years old?
Yes, yes.
Yeah. And I think we can see from your statement that when he was 8, he was diagnosed with leukemia and received treatment at the Royal Hospital for Children and also the Queen Elizabeth University Hospital. And I think that was between May 2018 and March 2020?
Yeah.
You've provided the inquiry with a detailed statement, and am I correct in understanding that you are content that that forms part of your evidence to the Scottish Hospitals inquiry?
Yes, I am.
Yeah. But you've also agreed to come along today and answer some more questions in relation to aspects of that, is that right?
Yes, I am.
Now, am I also right in understanding that you have a copy of your statement beside you?
Yes, I have.
Now, can I reassure you that you're not here to be tested on dates or anything of that nature, but if you do wish to have a look at your statement at any point, just do so and indicate to me that you wish to do so. Is that okay?
Yep.
Let's begin the detail of your evidence then, and can we start with some background? I wonder if you might tell us a bit about your son. We think it's important that we understand who these stories are about, so it would be helpful perhaps if you could give us a bit of information about that. I think he was in primary 3 when he was first diagnosed, is that right?
Yeah, he was in primary 3 and had increasing lethargy or tiredness, and had complained of a sore leg.
Yeah, I'll come on to that maybe in a bit more detail, but what sort of wee boy is he?
He was quite a chatty, sociable boy. He is on the autistic spectrum, so he's very fixated on his ideas and interests. But in general, he used to be quite a chatty boy. He would speak to everybody thinking that they're his friends. And computer games was his, and is still his life.
Is he quite an academic wee boy?
He is very academic. He loves school. Absolutely adores it.
He loves
school. He did. That's one of his biggest things he missed.
Now, I want now to proceed to just start to work our way through the history of your son's illness and his treatment. You have prepared a timeline for us. It's attached to your statement. I'm not going to ask you to turn it up. I am going to ask you this question. What was the timeline based on?
So the timeline was based on probably to do with the start of my job, my mobile phone. I'd saved some dates on my phone just intermittently during times that there was maybe of significant note, or just keeping things up to date in memory.
And are we right in understanding from your statement that you also now have a copy of your son's medical records?
Yes.
And did you rely upon those at all in completing the timeline?
I only used that once to confirm about a sample, but the rest I just had read through. I've not actually used that as basis.
Yeah. So it's a combination of your memory and what you'd saved on your phone in the main. Okay, well, let's begin the story. I wonder if you could describe to us what it was initially led you to think that your son might have something wrong with you, and I wonder if you could then describe what happened after that.
So it was my daughter's birthday, and my son was complaining of a sore leg. He had a sore leg, but it was bouncing about. That was fine. It resolved. A couple of weeks later, he started saying his leg was sore again. So this started on the Monday. By the Wednesday, he was not walking that great at all, and he was complaining of a really, really sore leg. So he was getting weight-related or stronger doses of Calpol and ibuprofen to manage that, and still going to school. I then taken him to my place that I worked at, or used to work at the time, and he was seen by a consultant who assessed him, had a feel of his leg, and said that there was nothing wrong with his knee. Although at the time I told him that he's tender on his distal femur, so the lower part of his long leg bone, and they said there was nothing wrong, so we went home. Then on the Friday, Craig was literally non-weight bearing, so he wasn't walking at all, couldn't walk, he was crying severe pain. His leg was much more swollen, so I'd taken him back to my place of my ex-employment, where he was x-rayed, and they found that he had a large tumour on his distal femur at that time.
Just stopping there, what was suspected at that point?
At that time, they suspected it was a bone tumour. They just said it was a tumour, they just didn't know.
And how did you feel on hearing that news?
My world crashed around about me.
I think we know that there was then a referral to the Royal Hospital for Children, is that right?
Yeah, one of my ex-colleagues that was an orthopaedic registrar, he spoke directly to Mr Duncan at the Royal Hospital for Children, and Craig was assessed on the following Monday with an MRI scan and bone marrow biopsy and things all very quickly thereafter. Yeah,
and are we right in understanding that, I think it's around about the 14th of May, that your son was admitted to, or rather there mid-May, that he was admitted to the, or seen at the Royal Hospital for Children for those investigations. And he's then sent home to await the result, is that right?
Yeah, so because of the complexity of his bone aspirate, there was too many cells, is what we were told, so they couldn't differentiate what kind of tumour or cancer it was. So they had to send it away for further analysis and further blood tests. And so
are the clinicians still thinking it might be bone cancer at this point, or are they now starting to think this might be something different?
Mr Duncan, the orthopaedic consultant at the time, was thinking it's probably no longer a bone or a bone tumour. Or it was a bone tumour, but it's not a. It's essential or starting cells was not a bone, it wasn't a sarcoma that was related to a bone tumour, it was another type of cancer that he had.
Yeah. I think we can see from the timeline that on the 14th of May, your son was admitted to have a central line fitted. Is that right?
Yeah.
And that was actually before there was confirmation of the diagnosis.
Yes.
So was that on the basis that whatever the diagnosis was, there was going to be chemotherapy? Is that right?
Yeah. They'd mentioned words leukemia, they'd mentioned different types of things, but they still were preparing that he would have to have some form of chemotherapy, so they put a central line in place.
And do we also see that over this period he was in and out of, I think, Ward 2B?
Yeah.
Was that for blood assessments?
Yeah, they were just routinely checking his bloods and just following up on him, just to make sure that he was still, you know, healthy or able to receive whatever they were going to decide.
And what eventually was the diagnosis?
The eventual diagnosis was that Craig had chronic myeloid leukemia with a myeloid sarcoma, and he was in blast crisis.
Yeah. Now, I want to ask you a wee bit about that. In your statement, it's at paragraph 4, for those who wish the reference, you tell us a wee bit about the different stages of CML, if I can just call it that for convenience.
Yeah.
Do you want to tell us a bit about that just now, and then maybe just give us an indication of what stage your son was at?
So all we ever found out was that there was 3 stages. You had the first stage, which was the chronic phase, so the disease is in control. The second stage is the accelerated, so that's where things are starting to get a little bit more, you know, the cells are becoming a little bit more erratic. And then you have the blast crisis, which is there's no healthy bone cell or blood cells being produced. And that is the final stage of CML, which then acts like an aggressive form of acute myeloid leukemia, which is a different type of leukemia, but it acts as deadly as that.
Okay, and can you recall what stage your son was at?
He was at the blast crisis.
Now, I think we can see that he was admitted to the Schehallien unit 23rd of May, and that treatment began, I think, 2 days after that on the 25th. What was the treatment plan, as far as you can recall?
So Shazzy's consultant said that for Craig, at the moment, they would have to try and get him into remission. And that was their main ultimate aim, to get Craig back into remission, and then probably it would have to get a bone marrow transplant.
And if we just take the 2 aspects of that then, the getting him into remission bit, would that mean hitting him quite hard with chemotherapy?
Yeah, he got quite a toxic doses
Yeah.
of
And
chemotherapy.
as far as transplant is concerned, was it definitely going to be bone marrow transplant, or could it be stem cell?
It's stem cell bone marrow, they're both the same treatment, just different names. But yeah, the technical name is stem cell treatment. Yeah, it was to get a stem cell transplant.
Thank you. Let's move then to think about this treatment. And what I want to do is just take it in stages using the timeline. And the first section I want to look at is the period between May 2018 and early August 2018. If we begin this way and just have you confirm which ward your son was admitted to.
So Craig was admitted from 2B, which was daycare, to 2A,
Yeah.
Schehallien unit.
And are we right in understanding that he remained there until early August, when he was discharged home for a few days? Is that right?
Yes, that's correct.
And did he have chemotherapy over the whole of that period?
He had chemotherapy at the end of May, start of June, and then had a prolonged period of neutropenia. I think it was up to 40 odd days where he was actually neutropenic.
Yeah. Is that an unusually long period?
Afterwards, yes, he had a prolonged neutropenia, which I think they were not expecting, and that was, we found that out at the end of his first cycle.
Yeah, and I think you've already indicated that this was quite toxic chemotherapy, is that right?
Yeah.
How did he cope with that?
He actually did amazingly. He had some inner strength that he just got on with it. He said at the start he was going to survive this and he was going to come home. And he did what he said what he was going to do. Yeah, so he did take it in his stride. He just went and did what had to be done.
Was he quite unwell during it?
Yeah.
How long did the chemotherapy last in this initial phase before he went on to being neutropenic?
His initial chemotherapy was about 8 days.
Okay, now I want to move on and just have you help us a bit with understanding what it was like to be in Ward 2A in those early weeks. The first thing I want to ask you about is his room. In which room did your son initially stay when he was on Ward 2A?
So Craig was admitted to room 1, which was behind the nurse's station.
And for those who want the reference on that, is paragraph 13 in Mrs. Gallagher's statement and the paragraphs that follow. I think you indicate that there was a change to the room that he was in. Is that right?
Yeah.
Why was that?
I think they were just moving about for cleaning and purposes and, well, at the time, infections or whatever. So they'd moved him over across the way to room 15.
Was there a particular room that he eventually ended up in and became his main room?
Yeah, his main room on his first cycle was room 20. So that room was a specialist room that was supposed to be designed to be as clean as you could possibly have it. So it had special air filters, double door entry, the control of infection.
What do you mean by a double door entry?
So it had an entry door as you went into like a small kind of cloakroom, as you would say, with a sink and a wardrobe where you could keep some things, and then it had that door would be shut and then there'd be a second door, and it was to maintain air pressure so that the air was always flowed out of the room instead of in.
Can you recall whether there was any discussion with any of the doctors about putting him into that room?
I don't know if there was any discussion, but Craig was actually not placed in that room immediately. Craig was neutropenic when he was in room 15, which is not a specialist room, and as eventually Professor Gibson was unhappy that he was still in the main ward and not being put in isolation, so he was out for at least 2-3 days being neutropenic in the main ward environment.
So did you say he was in room 15 and he was going out and about in the ward as well, is that right?
Yeah, he was just straight across from the nurse's station with his door wide open with no precautions in the sense of...
And I think Professor Gibson wasn't very happy about that. And so it was her instruction that he was to go into room 20, is that right?
Yeah, had to go into strict isolation.
Yeah. How long was he in room 20 for, as far as you can recall?
He was in there for the remainder of his kind of neutropenic stage, so he was in there for at least 5 weeks or so.
Yeah.
It was quite a long time.
And can you recall whether he was in other rooms that were similar to room 20?
He was during his second cycle. He was in different rooms on the other side of the ward.
Okay. And when was the second cycle?
Second cycle would have been about the end of July, start of August.
So he had an initial cycle of what, I think you said 8 days, and then a break, and then the second cycle began, is that right?
Yeah, they had to postpone his second cycle because his neutropenia was so long, but he had a couple of days break and then put back into chemotherapy.
Okay. And sorry, the rooms that he was in at that stage were rooms 23 and 24?
Yeah, so he was put into rooms 24 immediately when he started his chemotherapy because his neutropenia was quite prolonged, and then moved to 23 in between times to allow room cleaning, and then put back into room 24. And
in answering the way that you just did, are you suggesting that there was a link between being in room 24 and the duration of his neutropenia?
And yeah, because he kept up like fevers and temperatures and things.
What sort of room was room 24?
So room 24 was another specialist room that had the two entry, so it had the entrance door and then the inner door, but it had different, all I knew is it had different filtration. So the original room that he was in had supposed to have its own ventilation system from outside source. The inner room, the room 23 and 24 had a different type of ventilation, which was more wasn't as deemed cleaner. It was used for a different type of transplant, but it had different ventilation systems compared to 20.
That's what I was going to ask you about. I think you tell us something about that in your statement. I think it's at paragraph 45, and you indicate there were different types of rooms, different types of patient. Is that right?
Yeah.
And are you indicating that, in fact, there was also different types of rooms for different types of transplant patients?
Yeah.
What were the different types?
So you had two different types. You had this is where I get it confused. So you have one where it's either a related donor, where it's their own cells they get back after treatment, or you have a non-related donor transplant, so they get stricter or more intense treatment to eradicate their immune system. And the rooms that Craig was in the second time were for the related donor, so not as intense treatment.
Okay. So room 20 is for the unrelated?
Yeah.
Now, are you able to describe the layout of the rooms that he was in? And to be clear, you've helped us with the isolation rooms, you've helped us with the sort of lobby area. Yeah. I'm just thinking now about the actual inner room, or similarly, room 20, the sort of the bedroom and bathroom aspect of it. Can you help us a bit with that?
Yeah, so you go in from the lobby area into your room. So normally it's a big room, you have your bed, and there's a wardrobe, and then you've got two double doors, which is where the toilet area or the shower area is. They're often at the foot of the bed, and as I say, they're just the doors are open and shut as easy, and in there you've got your toilet, your shower, and your sink, and there's a sink in the room as well, off to the side.
Okay. Now, when your son was on the ward, who stayed with him?
My husband and I, during his chemotherapy, would take turns around about staying with him or staying over in Marion's house. We didn't always stay every night with him because once he was sleeping, and we needed the time out because it was intense isolation. So you're in a room on your own with him, near enough. It would be 24/7, which is hard going for him, and because he's an 8-year-old boy that wants to have his freedom. Yeah.
So you would go and from time to time stay in Marion House?
Yeah.
And that's the house that's nearby and operated by the Click Sargent charity, is that right?
Yes.
Yeah. And I take it whoever wasn't staying with your son would be back at home looking after your daughter? Yeah?
Yes.
I want to move on then and think about and have you think about and tell us a bit about the facilities on Ward 2A. What facilities were there on the ward for a boy who was the same age as your son?
Nothing. Was
there a playroom on the ward?
There was a playroom for younger children that like to play with dollies or Lego, do arts and crafts, those kind of things. Yeah. Then there was a room for the teenagers as well that had computer games, pool table, jukebox, sofas, like a hangout space. Craig, although with his treatment he wasn't able to leave his room, but there was nowhere. He used to try and encourage him to walk to the playroom, which he would do, and then he would go in and get disappointed or upset because there was nothing that was appropriate for him to play with. Yeah.
Was there a play team that came to the ward?
Yeah, there was a play team. Again, Craig enjoys science, he enjoys computers, so he's not your typical 8-year-old boy. So he used to always kind of quiz and ask about more advanced stuff like space things, and there was very little that they could offer him because they didn't have those kind of things in place for him. Mm-hmm. They did buy him a computer game to play on his Switch or his Xbox, so they did try, but there was very limited things that would interest or entertain him.
What about facilities for parents? What facilities for parents were there on the ward?
There was a parents' kitchen, which was great. You had a place that you could put your food. So Craig was quite funny. He always liked to eat just chicken. You know, you just give them whatever they feel they need. But it was a place that you could put cold drinks in. They loved milk. Go and get milk. There's a place you could have a cup of tea, coffee, eat your meals, or even just sit on the sofa and just look out the window and just have time to yourself.
And did you ever speak with other parents when you were in the parents' room?
Occasionally there'd be somebody there. Again, it just depends on the time of day and night. But yeah, I spoke to some parents and some grandparents when I was there.
Did you find that helpful?
Yeah.
Now, ignoring for the moment issues to do with the water supply, which I'm going to ask you about towards the end of your evidence, what was your overall impression of Ward 2A?
For me personally, I thought it was quite a dark, dull place when you walked in the corridor. It was just seemed quite claustrophobic, crammed in. Although you did see the kids run about as normal, shouting, screaming, playing in the corridor. So yeah, it was quite fun that way. But I just felt it was quite a just dark place that wasn't that nice in the corridors.
So you're indicating you've got sort of conflicting views on it. Would that be fair?
Yeah.
I mean, if we look at what you say at paragraph 53, just have a wee look at your statement.
But yeah, I did love it because
we began to love Ward 2A because it became our home for so long.
Yeah.
You know the staff, you know how the processes work, and you know what you can get. You want to explain a wee bit more about all of that?
Yeah, so it was comforting because it was one of those safe places that everybody looked after everybody. You bumped into somebody, you'd ask how their kid was, or you'd ask how they're getting on. Is it they got neutrophils yet? So they understood the chat. You know, they understood your aims. Is it a good day? Is it a bad day? The nursing staff and the cleaning staff and Betty, the dinner lady, they just looked after our kids like they were their own. And just mothered them when we weren't there, or comforted them, or comforted us.
I'm going to come on in a minute to ask a bit about the other side of the coin that you indicated, the dark environment, as you put it. But before we get to that, just wonder whether you can recall whether any of the staff ever said anything to you that might indicate that there were issues with the hospital environment. I'm thinking about when you were first admitted to the ward.
So we were in Ward 2A, 2B, waiting for Craig's bed to be ready. His bed was ready, and the sister of the daycare was helping us through, and she was like, just to let you know, the ward's under investigation for environmental issues. We don't know what the issues are, but there is environmental issues, and that's how it was kind of put across, but everything was in hand, and we were, it is what it is, and it's getting looked at, and it was...
And what was your reaction on hearing that?
I kind of chuckled a wee bit because I thought, yeah, it'll probably be ventilation because this place is sweltering.
Because it's
sweltering, it was hot. Because
right.
when you walked into the actual 2A, it was really dark and there was no air, no flow of anything.
For those who want the statement references, it's paragraph 73 to 74 for that aspect of Mrs. Gallagher's evidence. Now, what you've just said really takes me to my next question, which was, what was the temperature like on the ward? Was it sweltering everywhere?
It was always hot, yeah. It was always hot and humid, and it was even worse because when we were in as an inpatient, that was when it was like one of the hottest summers. And yeah, it could be hot. There was very little chance to try and cool the air. One of the auxiliaries said one thing that you can do is open the toilet door, and the cooler air is in the toilet. And that would force the cool air from the toilet into the big main room, which now looking back is the toilet's open and the toilet bowl's open with water and you're flushing.
You mentioned a moment ago something about it being dark. What do you mean by that?
So when you went into the corridor, it was like a deep purple. Everything was deep purple. All the walls. There was very little like intense or bright lights. Just had purple stickers and things on the wall. It just seemed quite a dark place when you went into it.
Can you recall whether the lights were on or off?
That was during the day. It was in the afternoon when Craig was put through.
And In addition to issues with the temperature, can you remember whether you noticed any issues at this point that might indicate something to do with the ventilation?
Yeah, when Craig was in room 1, the ventilation shaft or the grid was hanging off down from the wall a wee bit. And it had like small little, like, it looked like sampling ports or something just dangling down from the actual air vent itself.
Did you raise that with anybody?
No.
Now, the next thing I want to ask you about, again, still thinking about these initial weeks on Ward 2A, is cleanliness. Did you have any concerns about the levels of cleanliness on the ward?
Yeah, they would clean, again, depending on different rooms, different isolations that the kids were in. So at the start, Craig was in a normal room, so they would clean once a day. But when he went into his strict isolation, they would come and clean in the morning. But it was the same cleaner that would clean the source isolation rooms. So the source isolation room, the ones that have diarrhea or vomiting, they would be cleaned first. And then they would come and clean the strict isolation rooms. And then they would clean then the general ward. And I just didn't understand why that would be the case. I would have thought they would have tried to have at least a clean person and a dirty person clean the rooms.
Were you present when the rooms were cleaned?
In the mornings, yeah.
Yeah. And were you required to leave the room while the cleaning took
No.
place? And can you describe to us how a room is cleaned?
So the domestics would do a top clean, so they'd just like dust a high level. They would then clean the toilet, then the main room, and then the kind of cloak area.
And was the room mopped?
The room was mopped, yeah.
And I think you've indicated that your concern was that the order seemed to be that they started with the rooms where there was thought to be infection. Is that right?
Yeah.
What size of team did the cleaning team comprise?
So in the morning there would be about maybe 2 in the morning cleaning. 24 rooms that had to be, well, they had 6 rooms that were special strict isolation rooms, and then they had the source rooms, which at one point it seemed like every child was on source isolation, so it's quite a high workload to clean all those rooms and do them thoroughly to the standard that they should be cleaned.
So was this something that concerned you then?
Yeah.
Did you discuss that with anybody?
No, because I was too busy focusing on Craig, but again, you have to put your faith in the processes. I used to speak to the domestics about it and just say, you're going in all these rooms, what precautions are you actually taking? And they're like, well, we wipe our mops down and change the mop heads. I was like, but you're still wearing the same shoes. I was obsessed about shoes when my son was in strict isolation.
I think you explain at one point in your statement that in the isolation room, your practice was to take your shoes off in the lobby area. Is that right? You'd be in your stocking soles in the bedroom area? Yeah,
or I'd get slippers.
Or slippers.
That was meant to be for inside the room.
The cleaning staff wouldn't take their shoes off, is that what you're indicating?
No members of staff would take their shoes off, they would walk right through.
Yeah. Now, in your statement at 1 or 2 points, you indicate that you saw from time to time a more specialised form of cleaning involving vapour.
Yeah.
Do you want to tell us a bit about that?
Yeah, so one day we were sitting in the room and these machines that looked like Daleks turned up. There were about 6 of them. And we were told that there were going to be steam vapour in all the rooms with bleach. And that they were in a process of moving us all about. But this came from the cleaning staff. That wasn't from the medical or nursing staff.
So it was the cleaning staff that told you everything that you were told about that? Yeah. Did they say why it was being done?
Just to do with the environmental issues, or they were just doing stricter cleaning. Right.
And did you actually see what the vaporised cleaning actually consisted of? Did you see what it was they did?
All we just knew is that they taken these machines into the room. The room was sealed for a period of time. You couldn't see in the room or know what was going on. They were all sealed up with special tape and like a special bag type thing. you couldn't go in the room for at least 24 hours, and then it had to be washed down and dried again.
Right. I mean, thinking again just about these early weeks, how regularly did this happen?
That happened at the kind of, I think it probably the tail end of Craig's first cycle. So yeah, but they had to redo the rooms again because they didn't do all the thorough cleaning because they were to do the drains. They didn't do the drains to start with. Then they had to go back and redo the rooms. So it was kind of a constant moving about beds all the time.
Okay. Do you mean they had to redo the drains with these machines?
Yeah, or some liquid because they started pouring like bleach or something down all the drains at one point, and they didn't treat the drains in these rooms before doing the steam vapour.
Okay.
So
as far as you can recall, the first time that you saw the vapour being used was towards the end of your son's treatment in August, would that be? Or
yeah,
July, August?
Yeah.
At some point, did you get a letter explaining to you something about this?
Yeah, I think there probably would have been a letter left in the room. Usually left sitting on top of the bin.
You want to have a look at paragraph 93 of your statement, and that might help you a bit. And in fact, 92 and 93 might be the ones to look at.
Yeah. Yeah, and we weren't allowed to use the sinks for pouring anything down.
Yeah, and what you said a moment ago about a letter or a leaflet, is this what you're referring to?
Yeah, it was just left in the bin in the room.
Yeah, and doing the best you can. Roughly, what did it say?
It just said that they'd found something in the drains and that pouring foodstuffs down was encouraging the growth and that we shouldn't be giving it to nursing staff to be discarded.
So is your recollection then that the concern was not about blocking the drains, the concern was about bacteria?
Yeah.
Okay, thank you. I want to move on a bit, still just staying within these early weeks, and I want to just have a think about the treatment that your son received. Am I right in understanding that he experienced a number of temperature spikes when he was having his treatment?
Yeah.
Do you know whether that's something that can be a normal part of therapy?
From what as I say, I have no experience in oncology, but from what experience or what I was told, that you could have neutropenic fevers just as the body's trying to reset and develop neutrophils.
Yeah.
Yeah, it can be common.
I think you described that at paragraph 13. I think you talk about the neutrophils fighting back or coming back. Is that right?
Yeah.
Do you recall a particular temperature spike on the 7th of July 2018? Yeah?
Yeah.
Apart from the temperature spike, why is that a memorable date?
It was my husband's birthday, but also it's probably one of the worst days that I've ever seen Craig.
Yeah. Now, in your statement, and for those who wish to reference, it's paragraphs 15 to 17, and we might look at those paragraphs in a minute, Mrs. Gallagher. But just thinking about what you've just said about being one of the worst days, I wonder if you could just walk us through your recollection of the 7th of July.
So yeah, Craig was just wanting to go to the toilet. So he got up and walked to the toilet and come back, and he just was quite agitated and shivery. And I was like, "Is everything okay, Craig?" And he's like, "I just don't feel very well." Just started to shiver and rigor. So I pressed for the button, and the nurse came in, checked his temperature, and it was kind of borderline pyrexic or high temp, but he was starting to kind of just get more and unwell, and kind of like this kind of red rash kind of developing on his body. And so the nurse came back and checked his temperature, and it had risen even more so. So he had a proper fever. At that time, there was a protocol that they had to any neutropenic, because he was neutropenic at that time. They have to get antibiotics, blood cultures, paracetamol and fluids just to kind of support them through that period of time. At that time, there was another child in the ward that I know was having a fit, so medical staff couldn't attend to Craig directly, so it was a senior nurse and the staff nurse that attended Craig, and then they got the advanced nurse practitioner to come and see him. They kind of check him over to see what they can do and what was actually happening to him at that time.
Mm-hmm. Let's just go over that in some more detail. You described him having something that you pronounced rigor, and we've had differing pronunciations of that word over the past 2 weeks or so. Some have pronounced it rigor and some have pronounced it rigor. Rigor, is that the correct pronunciation?
I think so. I've never been corrected on that term, so.
Proceed on the basis that as a nurse practitioner, perhaps you might be correct about that. What is rigor?
So rigor is basically where the body's temperature goes so high to the point that it's the easiest way to describe it is the body's turning the thermostat up. So the body recognises there's an infection. So in order to kill the infection, it needs to increase the temperature to kill off that bacteria, virus, or whatever. Sometimes when they have an overwhelming infection or sepsis, they can have this rigor, and that's just basically the body starting to make the muscles twitch and shiver to increase the body's temperature further to kill off the bacteria.
Yeah, well, that was going to be my next question, which was to ask you, how does rigor present?
So usually it would be somebody's like they just cold, sweaty, clammy, or they start to shiver, and that's just the body kind of trying to increase its temperature.
And when your son was experiencing this, were you distressed?
Yes.
Physically distressed?
He was, yeah, because he was panicking, thinking what was happening to him.
And how were you feeling as you're observing all of this?
Again, I've probably my nursing background coming in, thinking there's something not quite right, something's quite seriously going on here. And we need to kind of get it sorted, knowing that he's got his central line, and he's also, I know he's got no neutrophils, so there's obviously something bad happening if he's rigoring. Because there's very little reserve in the tank in terms of his immune system. Yeah. And at that point, he was on 4 different antibiotics. Yeah. So he was on pretty much everything that they could throw at him. Yeah.
Just before we move to that, I think you described in your first answer on this a moment ago, you said he had pyrexia, or he was near to having pyrexia. Was that the way you put it? What is pyrexia?
So pyrexia is a high temperature, anything above 37.8 and above.
Moving on then to what you've just said, he's already on 4 antibiotics, is that right? Those were preventative antibiotics?
But no, that was actually still treating the fevers that he'd had previously, before that event.
Part of the protocol. And are you indicating then that, at what point was he put onto those 4 antibiotics?
So they would have been staged approaches, because he was probably having fevers, because his neutrophils trying to rise up beforehand. So every time he had a fever, or they would review him, they would put either an antibiotic on or change it to something else, or to add in another thing. So yeah, he probably had got to the point of that he's had so many fevers that he's probably been put on at least 3-4 different antibiotics to try and combat that.
And are you describing not the minutes before this particular event? Are you describing days and weeks?
Yeah,
before?
this was, as I say, because again, it's quite common for him to develop a kind of neutropenic fever.
Yeah. So, in fact, just going back to the start of this bit of your evidence, when you said that there had been a number of temperature spikes, you're talking about over that period, he's on these 4 antibiotics, as far as you can recall, is that right? Yeah. And during this event, was there a discussion about putting him on further antibiotics?
Yeah, so the doctor came and says, I'll give him a different we're going to give him another antibiotic. And I went, no, you're not. You can't give him any more. He's on all these different antibiotics. He's on meropenem, he's on gentamicin, he's on vancomycin, which are pretty toxic antibiotics. And he was also on caspofungin, which was an antifungal. I says, so if you're telling me that you're on 4 different antibiotics and he's got a neutropenia, he's got a fever, and you want to give him a further antibiotic, it's not going to make a difference. And I think they should stop using the line.
Okay. Could you give us the names of those 4 antibiotics
Yeah,
again,
sorry.
please, for those who are noting?
The first one was gentamicin.
Yeah.
Then there was vancomycin.
Vancomycin. Yeah.
And then there was meropenem. And then it was caspofungin.
Sorry, the last one.
Caspofungin.
Right. And why were you concerned about the suggestion that he be put on a 5th?
Well, I would have thought with that combination of antibiotics, that would be surely controlling his fever or his infection. And if they're giving him that and he's still having a fever, then I think there's something else going on that needs to be further investigated, or there's a source somewhere. And I knew Craig's body, like the back of my hand, there was nowhere else that there could have been a source of infection other than line.
So you're already beginning to suspect there might be a line issue here at this point?
A line or something else kind of going on.
In addition to Rigering and the presentation around that, were there any other signs that there was something not right at this point?
His skin.
How did his skin look?
He was starting to develop this kind of red rash across his body, and his limbs and his body, his torso. It just didn't look like your average kind of like chicken pox. It just it looked like either a reaction or some kind of. It was quite a red rash.
How quickly did that come on?
Very quickly.
Seconds, minutes, hours?
Probably minutes. It was very subtle to start with, and then over the coming days, or even the next day, it was more apparent.
Yeah. And talk about the next day. Was he still exhibiting a temperature by this stage?
No. Things had settled down when he stopped using his line.
What do you mean he stopped using the line?
So there was a discussion at that time, because the doctor was coming in adamant he was to get another antibiotic or something for his line. I said, you're not giving him any more. Rest the line, give him a chance, and let him recover and see what is happening. He was unhappy, but the advanced nurse practitioner who was on that day agreed, and we thought that stopping using the line, giving it a 24-hour break, and it would give us a chance to see what was happening. And the next day the professor reviewed Craig, and he was much better and improved.
Professor Gibson?
Yeah.
And when you say rest the line, are you meaning rest the line as regards all antibiotics?
Everything, stopped everything.
And are you indicating to us that over that 24-hour period, or by the next day at least, the temperature had stabilised?
Temperature had reduced and he was much better.
Yeah. But he still had the skin rash?
Yeah, he had the head to toe red rash over his body.
Now, can you recall what discussions there were at this stage about what it was that was causing this?
Yeah, so there was concerns because the rash was quite red and florid, so it's like bright red, that it could be measles. At which point I was beyond livid, because he'd only ever been in isolation, and I've had measles. Everybody we know has not had measles, so I didn't see that as being a valid reason for the red rash. But there was concern because he was in that strict isolation room where the air pressure blows out into the corridor, that they had to move him out of that room. So they literally just packed him up and put him into an open access ward room.
Yeah, I think you deal with this at paragraph 18. I think, as you've just indicated, you're indicating to us that the room he was in at this point was one in which, as it were, the air is pushed out, protect from infection coming in. And at the point where there's now a suspicion of measles, there's obviously a concern for other patients, is that right? So he's moved room at that stage. And what sort of room was he moved to then?
Just a normal ward room.
A simple single room?
Yeah.
Now, I think you said that your son was beyond livid. Was it, or was it you?
It was me. I was beyond livid. Because I was like, how did he manage to even get measles? You know, everybody, you'd have thought in that kind of ward environment, everybody should be tested or immunised against all childhood diseases.
Yeah. I mean, how long had it been since your son had been at home?
he hadn't been home for at least a week, 4 weeks. So
Yeah.
and he had no contact with his sister either.
Well, this was the 8th of July, so it was at least 4 weeks by then. Yeah.
The only contact he had was between me and his dad.
Yeah. So you were pretty concerned to hear that there might be measles on the ward. Is that really what it comes to?
Because where did it come from?
Are we right in understanding, Mrs. Gallagher, that eventually this presentation stabilised and the skin rash disappeared? Is that right?
Eventually, yeah.
Yeah. And I think we can see, just turning back towards the timeline, I think we can see that your son was discharged home for a few days at the start of August 2018. Had he finished, I think, what would be his second cycle by this stage?
No.
No.
Would have been, no, he hadn't. No.
No. So he was discharged home mid-cycle, is that?
No, he was discharged home at the end of his first cycle.
I see.
As I say, it was quite a prolonged. I think he was in 40 odd days before his neutrophils returned.
I see. So a cycle comprises the 8 days of actual treatment at the start, and then the 40 days of being neutropenic.
Yeah, so basically the cycle would be the start of his treatment, so start of chemotherapy right through to the end when he gets return of neutrophils. So yeah, his was very prolonged.
Right. At the point, if you can recall, at the point where he got to go home for a few days, how was he doing?
He was doing good, yeah. He was going home, he was eating what he wanted to eat, he was happy.
How were you doing?
Yeah, happy I had him home. Because home doesn't feel home without your kids beside you, especially when we've been separated for so long.
Yeah. At this point in time, was there as far as you can recall at least, was there a projected date for his transplant?
Yeah, so when we were told about Craig's leukemia, we were advised that the transplant date would have been set for September. There was no fixed date, but September was his transplant date because they obviously had found a donor that was 10 out of 10, fantastic match, the best that we could get for him.
Now, one other thing I wanted to ask you about before we move on through the timeline is preventative antibiotics. And again, just thinking about these early weeks of care, can you recall whether your son was on any preventative antibiotics?
Yeah, they started him on ambizone at the start to cover, they put it as fungal infections, because that's how it was put to us at the time. Didn't have much time to get Craig onto chemotherapy. They started him on ambizone, which he had an anaphylactic reaction to, so they changed that to the caspofungin. And he was on that throughout his first cycle of treatment. It wasn't till we were discharged, or going to be discharged after the first cycle, that Dr. Chowdhury had indicated that he doesn't need to be on posaconazole or caspofungin because he's not going to be in hospital. He's out of the environment.
Well, that's what I was going to ask you about. You indicate, paragraph 70 of your statement, you indicate a discussion with Dr. Chowdhury about the use of preventative medication. And I think you just have a look at that. I think you indicate that at the beginning, Dr. Chowdhury had indicated he would need to go on to posaconazole, caspofungin, and I think you also indicate he was on ciprofloxacin, is that right?
Yeah.
And just have a look at the rest of what you've said in paragraph 70, then I'll ask you a couple of questions. So what I want to know is, at the start of your son's treatment, what you were told about the use of preventative medication of this nature?
At the start, we were told they just needed to have antibiotic cover for infections. That was the kind of general gist of it, maybe hospital acquired or just in general skin infections, anything like that.
When, as far as you can recall, did you have the discussion with Dr. Chowdhury that you referred to there?
So the discussion about the posaconazole was when he was getting discharged after his first cycle of chemotherapy. She was going through his Cardex and she was like, oh, you'll not need the, well, caspofungin he wouldn't get because it's IV only, but she went, oh, you'll not need the posaconazole because he's not here. He's safer at home.
Where were you when you had that conversation?
That was in Ward 2A.
Yeah, in his room?
In his room when she
Yeah.
was going through his Cardex.
And you specifically recall a mention of posaconazole, is that right? And what was it she said about that?
He's not here
Uh-huh.
and he's going home. He's safer.
And do you recall what, if anything, she said about being here, i.e. being in the hospital, meant that posaconazole might be required?
It's just more to do with the environment or infections.
And really, in essence, what you've said in your statement, that's what you recall? Yeah. Okay, let's move on a little bit, Mrs. Gallagher, to look at the period August to September 2018. Now, I think we know that your son was readmitted to begin a new cycle of chemo, would that be right?
Yeah.
And can you recall whether he was in isolation again over this period?
We put him straight into isolation.
Right. Can you remember which room?
Room 24.
And for those who want the statement references, were round about paragraph 20 and 21. And again, I was going to ask you about cleaning. Can you remember whether you saw the Dalek cleaning, if I can call it that, again during this period?
Not that I can think of.
Okay. Who stayed on the ward with your son over this period?
That time was a bit between, it was kind of more shared care with my husband and I at that time because my daughter was going to start primary school.
Yeah. So, did your mum stay with your son?
Yeah, she stayed sometimes with him, yeah.
To allow you and your husband to be with your daughter when she had her first day at school?
Yeah.
I think we know from your statement that over this period of time, your son underwent 2 surgical procedures, and I'm going to ask you a bit about them in a minute. Just thinking about what led up to that, and I'm thinking about, I think in your timeline you describe it as being sort of late August. I think, in fact, your son might have got to go home again for a few days. Is that right?
Yeah, he finished his cycle and we got him home for a couple of days break.
Yeah, so that's helpful. So we went back at the beginning of August, and how long would the cycle last?
That one was slightly shorter, but yeah, I think it would have still been about the 4 or 5 week mark. So it would be, he was discharged late August, early September time.
Okay, and I think you indicate in your statement that you became aware of him complaining about something.
Yeah, he was complaining of a sore stomach.
And was that initially at home? That
He was complaining of that during his second cycle of chemo. They wondered if it was maybe more chemotherapy related or more related to the chemotherapy in the recovery phase. And it was again spiking temperatures. And I thought he maybe had appendicitis of some sort. And the professor, one time he had a fever, had assessed him and felt that he had to get growth hormone to stimulate his neutrophils again because he was unwell. And that's when they thought he had appendicitis or appendix problems.
So if we just take this in stages then,
Okay.
I think, sorry, forgive me, I think, was it you who initially suspected that it might be appendicitis? Yeah. And did you examine him and think that might be what it was?
Yeah.
And Professor Gibson thought the same?
Yeah.
And the decision based on that was to do what?
So they asked the surgeons to come and see him and to assess him, and he had pain, as classic for appendicitis. They ultrasounded him, but they couldn't find anything. But the agreement, or we were preparing Craig to go for a transplant, so any signs or any source of infection, we'd have to deal with that and need to get his appendix out if there was any question. It was to get an appendectomy.
Yeah. And is that what happened?
Yeah, after me arguing with the surgeons, yeah.
Sorry?
I had to argue with the surgeons and the professor.
In relation to what?
They felt that he didn't need an appendectomy.
Yeah.
But from what it was put from myself, from the professor, and us taking a risk about Craig going into a transplant where he has no immune system, it was a source of infection, it needed to come out.
Yeah. I mean, for those of us who don't have a medical background of any kind, what was the risk that you were concerned about with the appendix?
So when Craig goes into bone marrow transplant, they literally completely obliterate his immune system, so he has nothing. So there's no white cells to fight any infection. He can't make his own blood cells at all. He's dependent on blood transfusions and things. So if someone gets to that, you can't even give them growth hormone to stimulate them to make their own blood cells. So essentially there's nothing you can do. If he develops an infection, they can give antibiotics and hope that he can recover from that, but there's nothing you can help him.
An inflamed appendix would be something that would
would be fatal.
Yeah. So ultimately the decision was that there should be an appendectomy, is that right?
Yeah.
Where was that done?
That was done in the Royal Hospital for Children in Glasgow.
Can you remember which ward?
He was originally in 2A, but because he was going to have he had a surgical complaint rather than a cancer complaint, they moved him to ward 3A.
And that would be?
The general surgical ward.
And that would be general anaesthetic?
General anaesthetic, yeah.
And how was that done? Was there an injection first and then?
Yeah, they used the central line to induce him. Now,
do you recall any discussions with any of the doctors involved in that procedure immediately after the procedure?
Yes.
Can you tell us a bit about that?
So the surgical team came to review Craig after the surgery and told me that his appendix looked lily white, as his words, and there was nothing wrong with it.
In your statement, you indicate paragraph 28, and just have a wee look at it.
Yeah.
You indicate that you had a discussion with one of the doctors, and he said something about a gram-negative infection.
Yeah. So again, Craig had returned to the ward. The surgeons had been, and Dr. Pinto, who is the oncologist consultant, come and spoke to me to say that, in fact, Craig's blood culture had grew a gram-negative infection, and that was all he had to say. Again, gram-negative infection could be from the gut, which would explain if it was appendicitis, but I had the surgeon just tell me his appendix was lily white. So
yeah. So the doctor who told you about the gram-negative infection was not somebody who was involved in the actual surgical procedure, is that right?
Yeah, it was the oncologist.
Yeah. So this was a separate investigation. Where had they taken the blood cultures from?
Central line.
Yeah. And that had come back showing a gram-negative infection. And did the doctor who reported that to you indicate whether that might have any link to the suspected appendix?
Yeah, well, a gram-negative infection can come from the gut. So again, if you thought you had appendicitis, then you would maybe expect that finding.
You also indicated that you did have a conversation with one of the surgeons who'd been involved in the procedure, is that right? And what was it they indicated about your son's appendix?
They did tell me that it was lily white. They did look like there was no infection.
Yeah. Now, you mentioned that at paragraph 29 of your statement, and you also indicate a discussion with one of the advanced nurse practitioners. Do you want to tell us a bit about that?
Yeah, this was like later on in the day, probably more towards like after dinner time.
Right.
Judy, the A&P, came in to say that, oh, Craig's got steno. And I was like, okay, he's got a steno infection. I never heard of it. So I was like, right, okay. And then, as I say, it wasn't until we kind of thought about it and Googled it and read about it, I was just, and I heard the term stenotramonas.
Yeah. So, as far as you can recall, when the nurse practitioner gave you this information, she referred to it as steno rather than stenotrophomonas. And did she say anything about what the likely source of it was? Not sure, can't recall.
I can't actually remember. I just was kind of more like, okay, he's got this line. I knew it was a line infection, but I just didn't know where it came from. Or
Yeah. Sorry, it's my fault. It's a bad question. As you've already indicated, the cultures had been isolated in his line. Is that right?
Well, they had isolated it in his blood, so it could have come from his line or it could have come from his body.
Right.
But it's the likely source would be line.
Okay.
After reading about it and things.
And just so we understand, at this point in time, did he still have his line in?
Yes.
So if we just, it's obvious from your statement that there were further discussions about this. We just pause at this point. On hearing that the appendix is lily white, and on hearing that your son's got something called steno, which you assumed would have something to do with his line, I think. Is that right? What was your reaction on hearing all of that?
I was upset because we forced Craig to go through a procedure that he might not need to have to get an appendectomy, and he was suffering great pain from that, and they had sent him to theatre, knowing that he had a gram-negative infection, used the line to give him these anaesthetics, operated on him, sent him back up to the ward with the line still in situ, and it remained in situ for at least 2 days before they could remove it again.
And when was it you started looking into or investigating what steno was?
The night I was told he had it.
And what did you do?
Read about it, Googled it. I asked to speak to Craig's consultant, Dr. Chowdhury, who met anyway, and I just asked where did the infection come from, and she's like, can't answer that, but I says I would like to speak to someone about it because I'm not happy. So she arranged a meeting with, and I assumed it would have been maybe infection control or the charge nurse, because normally when you do a complaint in the NHS, you deal with the responsible for care in the first instance. And I was under the impression that's who I would have had a meeting with, and a meeting was set up. Because I know Shazzy was going on holiday, and there was a meeting set up between Jamie Redfern, the deputy manager of the hospital, and Teresa Inkster, the head of infection control or microbiologist.
Okay, well, I'll come to that in a minute, and we'll just take this in stages again, if I might. In your statement, you indicate that around about this time, you had another conversation with a nurse. Do you remember that one?
Yeah.
Tell us a bit about that.
So the nurse came in to do his observations, and I was like, oh, have you heard Craig's got steno? And she went, what, Craig's got it? Kind of thing. And I was like, yeah. She went, oh. And then she was kind of saying that there was more kids unwell in the ward than what we know. Okay,
so just stopping there. For those who want the references on this, it's paragraphs 61 and 62. What, if anything, did you read into her reaction on you telling her this news?
That she was shocked.
Shocked? In what way? Concerned?
I think, yeah, she was upset that it looked like he'd got a line infection. She was quite concerned. and I'd asked if it had been in relation to the rooms that he had been in. Because obviously, did you see from my statements that there was some people coming in uniforms, looking in drains and doing all the cleaning things, and she was like, you know, you're closer than what you know.
Can you just walk us through that in a bit more detail? So you had the exchange about Steno, and you indicated a moment ago that she said something about other children having it. Is that right?
She said there's other kids that are sick. Yeah, they've got infections as well.
Right. And what was it you then asked about a connection with the rooms?
So the rooms that Craig were in, and I know of what a little boy, or a boy that was in one of the rooms that had subsequently passed away, but I knew he had long-standing other issues as well. But when Craig was in that room, there was people in burgundy uniforms coming in to look at the sinks, taking pictures. And obviously the tour and phone between 24 and 23, there was a lot of movement between those rooms for cleaning, as they would say. And I just kind of, again, suspicious mind thinking, is there something else going on here?
So and was it, which of those two rooms can you recall that you had a concern about?
Rooms 23.
Yeah. And so it's the fact that there was a child unfortunately had died in one of the rooms, and also that there had been these people coming in uniforms doing some sort of work. Is that right?
Yeah.
So you asked her if there was a connection, and what did she say?
I'm closer than you can know.
Is that all she said?
So she just said, I'm probably, she just said that was closer in my judge or my concerns than what she could discern to, and that there could have been a link. That's all she kind of said.
How was she during this conversation?
She was quite upset.
Did she give you any indication as to whether there were other discussions going on about this issue?
She just knows that there was kids sick, and nobody was listening to the nursing staff. They had been under intense scrutiny, being investigated by infection control about their practices because of the high levels of infection in the ward, and she felt that nobody was listening to, you know, it wasn't the nurse's fault, you know, it wasn't the medical staff's fault, is it the building? You know, there are things that are out with their control.
Thank you. Now, if we move on a bit from there, but maybe before we do so, I wonder so we can identify the particular passage in your statement that relates to what you've just said. I wonder, Mr. Costello, if we could maybe just have a look at that passage. It's paragraph 62, page 21 of bundle 5. Can you just confirm that paragraph 62 is the passage which outlines your evidence in relation to the conversation you've just told us about? Is that right?
Yeah.
And you say, I also asked her the question about my son being in room 23, ward 2A previously, because there had been a young boy in the ward roughly at the same time who had sadly passed away. He had been in room 23 and had mostly resided there. I asked the nurse if my son's infection had something to do with that room. It was never really used, and there always seemed to be senior staff and management around the room. That's what you recall, is that right?
Yeah.
I also asked if this room was a hotspot for Steno. She replied, you don't know how close you are. She got quite upset and distressed. She said, nobody's listening. More kids becoming unwell in the ward, and nobody's really paying attention. How clear a recollection you got of that conversation?
A good one.
You said that the nurses were the ones that had been cross-examined and interrogated and told it was their fault when it had been something out with their control. Thank you. We can put that to one side, Mr. Castell. Thank you very much. Now, a moment ago, you indicated that there had also, around about this stage, been a discussion with Dr. Chowdhury. And if it helps you to just sort of relocate where that is, it's paragraph 63 of your statement. I think you deal with this. Can you recall where you were when you had the conversation with Dr. Chowdhury?
I was actually in the ward at the time because Craig was still an inpatient.
Yeah. And can you tell us a bit about that conversation?
So the conversation with Shazzy was just regarding, you know, where did Craig get the Stenophotromonas? Because I know he'd only ever been from home into the ward. He hadn't been anywhere else. I don't play with his lines. We don't, you know, and I just didn't understand, you know, why did he get this? Because I know he had been home for a couple of days. Why did it, you know, why now? And we kind of come to the conclusion maybe because he was off all these different antibiotics that the line had then started to become more colonised, no longer under control. Section.
When you say we came to that?
Well, Shazzy and I, we assumed because obviously he'd stopped all the antibiotics, the line was rested and left. There was nothing going through or treating anything that was going on, so the line must have been just growing more and more bacteria and infection.
Yeah. What did she say that she would do about this matter?
She would contact someone in regards to my complaint.
And would that be somebody in infection control?
I assumed it would have maybe been an infection control nurse or manager. You know, I just thought it would be somebody from infection control.
Were you told after that there would be a meeting? Yeah,
there was going to be a meeting, and she was going on holiday, so she couldn't attend. And I just assumed that it would just be a meeting between myself and whoever was coming from infection control.
Okay. Now, we'll come to that in a minute, but I think we can see from the timeline that there was further surgery on the 11th of September to remove your son's central line, is that right?
That's correct.
But was he still having antibiotics at this point?
He was having antibiotics to cover the line infection.
Yeah. And did that continue after the line was removed?
Until they were able to get, as long as they were able to get IV access on him, yes. But after a time, they failed. There was no. His veins had all shut down and was suffering greatly, getting cannulas put in.
Yeah. Well, we'll come to that in a minute. But after the line was removed, I think you indicate there was a concern that there would be something called break-off of bacteria into the bloodstream, is that right? And was that why there required to be further antibiotics, is that right?
Yeah, to get anything.
And as you indicated there, only insofar as they could do so intravenously, is that right?
Yeah.
Now, for those who want the statement reference, we're now at paragraph 32, and I'm going to ask you a bit about how it was they administered the antibiotics intravenously after the line was removed. Do you want to tell us a bit about that, Mrs. Gallagher?
Yeah, so Craig, if I mind right, had to get 2 injections, one in the morning, one in the evening. So he'd have cannula put in, and he was allowed to, kind of negotiated that he could come home and have a day pass. But often or not, the cannula was dislodged or moved, so he'd have to get another cannula put in, and at some points he would have to go to his feet, which was a kind of boundary for Craig that just made him too distraught. So it got to the point that we just asked the doctors, is there any way we can move to oral medication to allow Craig not to undergo several attempts at IV access? Kept him. We did attempt to keep him into the hospital to see if that would save the lines, but it didn't make any difference. The cannulas were. Are
you able to describe to us the process of your son being given a cannula?
So, in terms of if Craig knew there was a cannula coming, because they get wise to it in the end, you have to physically hold him down and restrain him. the point of him screaming that it's worse than death. It's the worst pain he's ever had, and to let him go. Sometimes he would happily let you sit and try, or you could put Amitop on, but essentially it was always a traumatic, especially when they failed and they would go to his feet, and that would just be, he was just even more distraught and upset.
And how many attempts on each occasion? How many attempts would it take to get a cannula attached?
The doctors would keep going until they got a line, but I would eventually, after a couple of times, I'd be like, "That's enough. You need to stop. It's too traumatic for him and for us to watch."
And eventually, there was an agreement that you would proceed by way of oral antibiotics. Is that right?
Yeah, on the proviso, if he got unwell, that he'd be straight back into the hospital.
Yeah. And I'm just wondering whether this was the occasion on which there was the discussion about was it conazole not being required?
No, that was after.
Now, I think we can see from the timeline that your son moved on to daycare after this. Is that right, for a spell?
Yeah, when the line came out, he was able to get just regular checkups for daycare.
Yeah. And what was the plan at this stage?
So the plan for Craig was to allow him to recover from his appendectomy, and then they delayed his transplant to allow that recovery. He needed 6 weeks for his wound to heal.
So that's a delay of 6 weeks. Now, your timeline indicates that you have a particular recollection of a day patient visit on the 20th of September. I think your father may have accompanied you that day.
Yeah.
You want to tell us a bit about what happened then, and I'll maybe ask you about the detail once you've done that.
Okay. So yeah, we were attending the daycare for just a checkup on Craig, and maybe plan going forward, because we were still awaiting transplant date because everything had been pushed back. So we're sitting in the waiting area, and the manager, Jamie Redfern, and Teresa Ringster had turned up wanting to speak to us, or to me.
And for those who want the references, this is paragraph 65 in Mrs. Gallagher's statement. You then had a meeting with them, is that right?
Yeah, that was my second meeting with him, yeah.
Second meeting?
Yeah.
So had there been a previous meeting?
Yes, there was.
When was that, roughly?
That was at the start of September, roughly about 6th or the 8th or something like that.
Okay. And what was that meeting about, the first meeting?
First meeting was asking where the stenotrachomonas, where did the infection come from?
Yeah, okay. And so was that first meeting the one that happened in response to the discussion with Dr. Chowdhury?
Yeah.
And at the first meeting, can you recall what was said?
So at the first meeting, Professor Gibson sat in as well, and I had asked about the stenotrachomonas infection, and Teresa Ringster had immediately apologised and said that, you know, she apologises for Craig having the infection. It was likely from the hospital. And I was like, okay, I'll have to accept that. I said I was unhappy, but from everything that I've read about the infection, once it colonises a place, it's colonised and it's in. And this is the second or third occurrence of something happening in the ward. What were they going to do about it?
And what did she say to that?
Nothing.
Did she dispute what you said?
No.
Where were you when this meeting took place?
That was in the parents' room in Ward 2A.
Uh-huh. And your recollection is that Dr. Ringster said that the infection had come from the hospital?
Yeah.
What did Professor Gibson say?
He was just there as a kind of listening to the meeting.
Do you have a recollection of her saying anything though?
No, she just said that she was kind of there just to kind of listen in to the kind of the meeting and the chat between myself and my complaint. because Shazzy couldn't be there.
And what about Mr. Redfern? What did he say?
Didn't say anything.
Okay. So the meeting on the 20th of September, how did that come about?
I think that was actually probably a follow-up to a phone call that my husband made.
And can you recall what the phone call had been about?
So I think, can't remember the dates, but we were at home with Craig, planning to go for a transplant, and it was in the news about Shahalian had shut and moved, or Shahalian was shut, is what we were told on the news. And we were in great shock. My husband phoned the ward, phoned the hospital, nobody was talking to us. He managed to get a hold of daycare, and the sister had spoken to him about, you know, they've just heard and there was no further information, but they would be informed of what the plan, or would be informed of something, and that's how it was kind of left.
Okay. And was the meeting therefore solely about that question, about the closure of the ward?
I would assume so, yeah.
Yeah.
After this, when we had the chat,
Yeah.
it was.
In particular, was there any discussion at that meeting about the infection?
They said as a result of what was happening or what they found in the ward, that they had to make a plan, and they needed to know that the plan could be in place before they can move the ward over to Ward 6A. Okay. And that Craig had a bed here in Glasgow.
So can I take you please to your statement, and can you have a look at paragraphs 68 and 69? You had a chance to read what's there. Can you confirm to us, is what you've set out there what happened at the first meeting?
Yeah.
Yeah. Okay, thank you. Lord, I'm looking at the time and I am about to move on to a new chapter.
If this is a convenient moment, we'll take our break just before past. As I say, we'll take a coffee break, about 20 minutes. So if I could ask you to be back about 10 to 12. Thank you very much. Mrs. Gallagher, perhaps Mrs. Gallagher be allowed to go. Hello again, Mrs.
Hi.
Gallagher. I think we're ready to resume.
Thank you,
Mr.
Lord.
Duncan.
Thank you. Moving on a little further then, in the timeline, Mrs. Gallagher, I think we can see from your statement, it's paragraph 35, those who wish the reference, that I think around the end of September, son had something called a PET scan. What is that?
So they use a form of radiation to basically show any fast growing or rapid growing spots in the body. So Craig had that scan at the end of treatment just to see how it's basically essentially check his sarcoma in his leg was doing.
Yeah, and what did it show?
On that scan it showed that he had a hot spot in his distal tibia.
What's a hot spot?
So a hot spot is basically a rapid area of growth.
And can you recall whether there was any explanation for that from any of the doctors?
There was no explanation. They had to their first concern was it a relapse or a recurrence of disease?
And was that investigated?
Yeah, he was given a bone biopsy.
Bone biopsy. And I mean, how is a bone biopsy undertaken?
So Craig was put to sleep, and they then get a needle or a kind of drill or a screw where they drill into the bone and take a small segment out to test it.
Okay, and that came back and disclosed that there was no recurrence. Is that right? So what at that point then was the explanation for the hot spot?
So as a result of Craig's original tumour, he had developed he basically broke his femur bone, and so he was put in a long leg cast. And they wondered, because his cast was then taken off during treatment and things, I did wonder if it was to do with his weight bearing, because he was walking very strangely and more walking on the inner aspect of his foot. Was it more trauma related to that than actual being anything sinister? And that's what they kind of concluded that it might have been. Okay.
And was there any thought that it might be anything to do with the infection?
Not initially, to my knowledge.
Right, okay. Did this incident have any effect on the date when his transplant was going to be?
Yeah, they put another 2-week postponement for at least 3 weeks.
Yeah. Okay, I want to move on to a different topic now, and that is the closure of Ward 2A. And we know that Wards 2A and Wards 2A and 2B in the Royal Hospital for Children closed September 2018. And I think my first question would be, when did you first hear about that?
It was on the media, the news.
Yeah. Where were you when you heard?
At home.
And you heard it on the news. And what was it you heard? That it was moving or that it was shutting?
It was closing.
How did you feel about that?
Distraught. We were planning for Craig to come for a bone marrow transplant. That was the completion of his treatment. He needed it in order to save his life. And we were under the impression that that's what was going to happen. He was to get his bone marrow transplant very quickly in Glasgow and get that completed. But when they told us it was closed, Glasgow's the only place in Scotland that does that treatment, and we were then looking at where do we go, what do we do? Do we have to go to Newcastle, Manchester? Where do we get the funds and try to then split the household up? We were just kind of going through all the options to get through and to get this done because it needed to be done.
What investigations did you make about alternative solutions?
Well, we didn't, because we didn't know what was we just knew that the nearest centre is either Newcastle or Manchester.
Yeah. And did you try to contact anyone on the ward?
My husband phoned the ward, there was no answer. He phoned daycare and there was engaged. Tried to phone Jamie Redfern, there was no answer. There was just no communication until the sister from daycare contacted us to say it's in hand and it'll be dealt with, kind of thing. And that's all they kind of said.
And was there any further explanation?
No.
In your statement at paragraph 110, you indicate some further comments by Mr. Redfern. on this issue. Tell us a wee bit more about that.
So obviously, I went into daycare as an appointment for Craig, and Jamie Redfern and Theresa Inkster was there waiting for me.
And just pausing there, is this the meeting of the 20th of September? Or
Yeah.
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 Sorry, on you go.
And they were waiting for me, and I was told that they wanted to speak to me. So my dad was with me, and they spoke to us, and Jamie Redfern had apologised about the lack of communication, but I had to understand that they had to make these plans in place first and make sure that the plans would work before informing people of what was happening.
Okay. And at that point, did he or anybody else indicate what the plans were as far as you were concerned?
Yeah, so Jamie Redfern had said that the plan was going to be Chahalian or Ward 2A was going to move over to 6B or 6A of the adult hospital, and that Craig has a bed for his bone marrow transplant, and it will be in 4B, which was the adult bone marrow unit. They were allocating some rooms in that, and he had his bed. That's what he assured me.
Yeah. And in fact, if we move on a bit in time, we can see, it's paragraph 36 for those who wish the reference, we can see that I think your son was admitted to Ward 4B on the 29th of October in the adult hospital, and that was to start conditioning for his transplant, is that right?
Yeah.
And the transplant itself, I think, was on the 8th of November?
Yeah, his actual date of sales were the 8th.
Yeah, and going back to one of my questions from right at the very start, what sort of transplant was it?
He had an unrelated donor, so it was a person that had donated their stem cells for Craig.
And I think he stayed on Ward 4B after that for a spell, and then was discharged to Marion House, is that right?
Yeah.
What happened when he got to Marion House?
He literally got home, or Marion's house, put his pyjamas on, and he looked quite red and flushed.
Right.
And it looked like he was about to take a fever, and we went back again.
To where?
We ended up having to go to daycare because they had already used his bed in 4B.
Yeah. So daycare at 6A?
Yeah.
And was he admitted?
He was admitted, yes, because he had a fever.
To the inpatient part of 6A?
No, there was no beds. So they opened up one of the daycare beds, or one of the daycare side rooms, and that's where Craig stayed.
That's very helpful, thank you. Can we look at paragraph 37 of your statement, Mrs. Gallagher? We don't need it up on the screen, Mr. Castell. I was going to ask you to just help me a wee bit with what you've said there, but you've already, I think, given us the answer. You say that he got put into a daycare room because they had no ward rooms left. It was a side room, but it was part of the daycare unit. They had just extended it and they put in an air filter in his room. It's really just that last bit about them extending it and putting in an air filter. What do you mean by that?
So the difference between 6A and daycare is that there's just like a double door. So what they just did is open the double door so that room could be part of the ward. So that was all they kind of did. And that was all just the way they absorbed the extra room into the ward.
Okay. We've come to understand 6A being one whole ward with daycare at the extreme end, the distal part, and with the inpatient care being before that. Are you saying that he was put into the area at the end, one of the rooms there?
Yeah, so it's like two corridors for 6A. So daycare basically takes the far tip, and then they have a couple of rooms in either like treatment rooms on this side here, and then further along you come, there's like a side room that I don't know if they've ever used it, but it was used for daycare, but to give chemotherapy and things. So they just opened the door, and that was where
Used one of those.
That was one of those rooms.
Yeah.
That was attached to the ward. Yeah.
Thank you. And at this point, what was the suspicion on the part of the clinicians as to what it was that was giving rise to this presentation?
Because he had a fever, they always would assume infection first. The professor reviewed them the next day and they thought it was graft versus host. That's Craig's body reacting to the blood cells because they were all developing and starting to.
But he was, your son was eventually discharged to daycare again, is that right?
Yeah.
Now, just pausing there and just thinking a wee bit about what you've said about 6A, did you have any issue with the way that 6A was laid out with where daycare was relative to inpatient care?
Yeah, so again, there's one entrance to 6A, which is at the lifts. So you have to come past all the rooms with your kid who's had any kind of infection and then walk round to daycare. So there's quite a high level of footfall past the doors. And again, comes back to my obsession with shoes, walking through the buildings and bringing anything up.
Now, we can see, just going further forward in time, we can see that there was a readmission December 2018, January 2019. And can you recall what that was for?
So Craig had developed a fever again at home, and we brought him in just to get him checked over, and he was still spiking temperatures. He was on antibiotics, and they were finding that his cultures were coming back positive for a Staphylococcus epidermis infection. So they kept, every time they sampled him, it was coming back with this infection, and eventually they decided to take a peripheral sample, so one off his line and one off his hand or his arm where they could get a blood sample, and they found that the one that was coming from his line had Staphylococcus epidermis, and the one that was coming off as a fresh draw off his hand or other place, it was coming back negative, so the line was actually infected.
Okay, that's really helpful, thank you. Now, I think for those who want the references, paragraph 40 of Mrs. Gallagher's statement, and I think we can see that the admission was on the 30th of December, would that be right? And as you indicated, eventually a line infection was confirmed, is that right?
Yeah.
And is it Staphylococcus epidermidis or epidermidis?
Yeah.
Something like that?
Yeah.
Yeah. And did he require more antibiotics at this point?
Yeah, so they were treating with all the kind of the neutrophil fever antibiotics because they thought it was infection, and they continued that after they taken the line out.
Yeah.
Until they could get a cannula.
So the line was removed again.
Eventually, it was removed a day or so later, and they had a cannulas put in for the antibiotics.
Yeah, and the peripheral blood test or blood samples, they would have been taken using cannulas as well, is that right? Now, I think we can see that there were further admissions in January 2019 into February. I think he attended daycare and he got immunotherapy, is that right?
Yeah.
And more chemo, is that right?
No chemo. He was on oral chemotherapy.
Oral chemo.
Yeah.
And I think that we don't need to go into the detail of this, Mrs. Gallagher, but I think that there were more temperature spikes over this period, is that right? Yeah. And when was your son's last admission?
His last admission was February 2020.
Yeah. And where was that?
So he was admitted to the hospital, and then they put him up into 3A or 3B, which was the orthopaedic ward.
In the children's hospital?
In the children's hospital. They put him up into the orthopaedic unit because, again, it was a specialist vented room because he wasn't allowed to be in the general population.
And was that because he was spiking a temperature?
Spiking a temperature, and he was still considered immunocompromised, so he's at risk of other things.
Yeah. And was there an infection confirmed on this occasion as well?
Yeah.
What was that?
I think it was adenovirus or the flu. It would have been adenovirus.
And then just completing matters, was your son's treatment in effect finished by this stage?
It was nearing the final of his oral chemotherapy.
Yeah.
They stopped that at the end of March.
And did he then go on to, is it essentially a review process?
Yeah, it's just in a review process, yeah.
Okay, thank you. That really completes the timeline aspect of things. And what I wanted to look at now was to just look at a comparison of wards 2A and 6A, because you give us some evidence in your statement about that matter. So maybe I could just start by asking you to compare the facilities on Ward 6A with those that you had experienced in Ward 2A. Can you do that?
So, in part, with Ward 6A, it felt like a prison. You were literally just stuck to your room. Again, for either source isolation or because there was no facilities at all on that ward for the children to do anything. The views were about the only good thing about it, because you could see the city of Glasgow. You could have a look around, watch the planes coming in, but there was no place to come out and have a break. There was no place to kind of meet anybody. You could see faces walking past the room, but there was no contact with anybody or anything, and there was nowhere. You were literally just living in your room.
Was this a greater amount of isolation than there had been on 2A?
Yeah.
What about from the point of view of parents? What facilities were there for parents on 6A?
There was no facilities for parents.
By way of, for example, a parent's kitchen, was there anything like
Nothing.
that?
We were offered meals from the trolley if need be, but again, the kids are not eating it. Are you going to eat it? There wasn't edible foods.
Mm. I mean, kids being fussy is not exactly unknown. Are you saying that that was something that was easier to deal with on 2A?
Yeah.
Why was that? Because
if you knew the kids were, well, Craig just loved milk, so you could go and get milk whatever he wanted. He wanted an isolate, you get him an isolate. Craig loved toast and butter. Make him toast. We could do all those things in 6A. They actually stopped that when he was in isolation down in 2A, because they felt that was a source of infection. But yeah, we couldn't make anything like that to keep him happy.
If you wanted those things on 6A, toast or milk or whatever, how did you go about getting them?
You'd have to buzz for someone to come in, or I would just go down to the shop in Marks and Spencer's and bring milk up.
Uh-huh. And in your statement, you indicate something about the impact on the staff as a result of this arrangement. What was that?
I don't think they had any facilities.
Yeah.
And they were always forced to go outside to have the breaks away off the ward. So,
but in terms of the the absence of facilities for parents to make toast or a meal or get a glass of milk, that mean that everything had to go through the staff?
Yeah.
So what effect does that have on the staff then?
It would increase their workload 10 times, because not only have they got a couple of parents or patients wanting something to eat, probably all want it at the same time, in a ward of, I think, probably 20 odd patients, and then their parents, that then makes it 50 people to look after instead of just their kids.
Yeah. Now, on Ward 6A, did the televisions work?
Sometimes. Just I think, yeah, they work better than what they worked down the stairs in Ward 2A, yeah.
So there was an issue there as well, and are you indicating that it was in fact worse on 2A?
Yeah.
We've had quite a lot of evidence about televisions not working. In what way does that impact upon a parent looking after a neutropenic child in an isolated environment?
It's soul destroying. You don't have any distraction. You're basically sitting watching your child lying in bed, either sleeping or being sick or feeling miserable. There's no distractions. And you really come cut off from the world outside. You really don't know what's happening.
Is your son somebody who likes stimulus?
Oh yeah, he would be quite happily with his iPad on, the telly on, and something else going on in the background. He's very much in. It helps to distract him because of his autism. So he needs that distraction, because that is often what we would use to get him to comply with some of the treatment demands.
Yeah. Is that what you mean when you say in your statement that you need an arsenal of activities?
Yeah. Spent a fortune on multiple things just to get him through what we need to get through.
Yeah. You got any other reflections on Ward 6A? I'm going to ask you some questions about water in a minute, but aside water, any other reflections on Ward 6A?
It just seemed like a soulless place. There was just staff were sad. They've lost their comfort, you know. And again, in Schiehallion, it did seem like a wee small community. Everybody was just isolated and stuck. And I think they were so saddened that they left their place of work.
Did it still feel like a community?
No.
I want to move on now and ask you some questions about issues to do with water. What advice, thinking back to Ward 2A and your initial, the initial stages of your son's treatment, what advice were you given about the use of water on Ward 2A?
There was no advice other than not to drink tap water. There was bottled water available in the parents' kitchen. There was filters. We were to use sinks with filters fitted. So there was filters fitted in the rooms. But that was essentially all the advice we were given, is to use bottled water for drinking and filtered taps.
Now, for those who want the statement references, paragraph 54, I've got a few further questions for you about what you've just said, Mrs. Gallagher. Who was it that provided the advice that you've just referred to?
It was one of the doctors, Sarah, and the nursing staff in the ward, the auxiliaries, that would come round and ask if you want water.
And what was your understanding of why you were not to drink the tap water?
Yeah, they just said it was down to make sure the water was clean. There was nothing, it wasn't specifically said. It was down to any kind of bacteria or anything. It wasn't until the doctor had mentioned that there's maybe something with the water.
Okay. Do you have a clear recollection of that conversation, or is it just something you've got a kind of vaguer recollection of?
That was done when we were down in clinic. She always was cautious, because in the clinic area there was no filters in the taps. So she would just say, make sure you wash your hands with the filters, because some of the toilets, even down the main atrium, didn't have filters on. In fact, I don't think they all had filters on them. Mm-hmm. It was just Ward 2A.
So what she was indicating, use taps with
filters.
With
yeah.
filters. What about drainage? Did you ever come across any issues in relation to, for example, the use of showers?
Yeah, every room pretty much flooded. Room 24 was particularly bad. You had to have quite a few towels rolled up on the floor to stop the water draining out into the main room. And Craig was quite impressed with himself one day because he managed to block the toilet and flood the room. So yeah, he was quite pleased with himself that day. He was slushing about in it.
Was this something you experienced, I mean the showers, is this something you experienced in more than one room?
Yeah. It was particularly worse in 24, but in room 1, room 20 wasn't as bad. In the other rooms, just a small amount.
Was this something you discovered yourself, or was it something you were told about in advance?
Actually, probably something I found out myself on the first day. But then one of the auxiliaries came in with an extra towel to say that's for the floor.
How bad was the flooding on any? What was the worst? If you imagine the worst occasion when there was flooding from a shower, how bad was it?
It was in room 24. It was literally coming up to the actual door of his shower area.
It was coming up to the
up to the wooden door, which was like the 2-door partition from the room.
So are you indicating that it was coming up to the door that separated the room from the bathroom, or are you?
Yeah.
Yeah. And over the whole of the period that your son was in hospital, what did you use to wash him?
I scrubbed him with an inch of his life every day, soap and water from the shower. Didn't want to. I know parents use baby wipes or water, but in my background, I was like soap and water. Even though it could, I didn't know at the time it could have been causing infection, but I thought that would be much better to scrub him and dry him hard and to remove as much bacteria as I can off his skin.
When you say you didn't know at the time, are you indicating that beyond what you've already told us about drinking water, indicating that you were unaware of any other issues. Now, I want to move on and ask you about some other concerns that you have about the hospital and that you've set out in your statement. First of these is paragraph 80, for those who want the reference. Do you recall, Mrs. Gallagher, being aware of a smell, either in the hospital or outside the hospital?
Yeah, it was pretty rancid. The smell of sewage, it hurt you from when you drove into the campus or even over at Marion's house. The smell, you could tell, in fact, you could always tell at 5 o'clock in the morning when the toilets were all getting flushed and drained. The smell just was so off-putting that you didn't want to eat or things. It was one of those things that you came accustomed to it, but yeah, you certainly couldn't ignore it.
Were you ever aware of it in the hospital?
It was quite particularly pungent in the ward. Or my statement, Craig was in room 20, which had an outdoor ventilation, which one of the specialist ventilation rooms, and the smell was particularly bad in that room for the smell of sewage. And you would have thought, with it being a filtered specialist room, that you shouldn't be able to smell any kind of odour from outside, because there should be a clean environment. You can smell it, then there must be something coming in with the smell.
Did the smell have any effect upon either you or upon your son?
Yeah, Craig was particularly quite distressed with it. It was sometimes off-putting. He didn't want to eat or drink or anything. Just didn't want you. It just was there. There's nothing you could do.
Now, you mentioned, I think it's at paragraph 84 of your statement, a different matter. You mentioned being given some sort of written warning about accessing the hospital, I think in August 2018.
Yeah.
Can you tell us a wee bit about that?
So that was when they were taking the cladding off the hospital on the kids' side. We used to park in the kids' car park, which was next to the building, so you could walk straight through and go up in the lifts. But according to this letter, they assumed with the cladding coming off, it was exposing or re-emerging some bacteria that was falling down to the ground. So theoretically, it could be falling onto our clothes that we could take into the ward. So they were advising us to park at the furthest away car park and walk in through either the main entrance of Queen Elizabeth or the discharge lounge entrance, past patients and relatives.
Now to move on to another topic that you mentioned. In fact, it's really three things, I think, all to do with pigeons. I think in your statement, a number of points, you mentioned issues that you came across, all sort of related one way or another with pigeons. Do you want to tell us a bit about all of that?
Yeah, so obviously with us moving over to the other entrance, if I was coming over, I'd park the car in the other car park, which was further away. But as you were coming through dead spaces, there was lots of pigeon excrement all over the place in the actual car park itself and on walkways. Then you were coming to come through the discharge lounge entrance or the main entrance, you're passing people that are smoking and there was pigeons and things around. When I was up in the ward 6A with Craig, one day I looked out the window and I could see dead pigeons all across the roof of the building that's between the Hospital for Children and the Queen Elizabeth, which is a theatre block. And I had a kids' play area and there were just several dead pigeons all lying out on top of the roof space.
Yeah, and in relation to the pigeon excrement that you saw on the ground, and I think you said it was on walkways, what was your particular concern about that?
Again, it comes back to my passion about shoes. People are walking through these areas with all on their feet, walking through main areas, walking through the wards and essentially walking into my son's room on their shoes.
You also mentioned that at some point you got a letter from the hospital or from the health board, something to do with fungal infections and pigeon droppings, is that right?
Yes, I think it was something to do with the Cryptococcus, yeah.
Can you tell us a wee bit about that, if you're able to recall it?
Yeah, so that came to light because Craig was literally, had completed his transplant, so he was back in as part of his line infection. And at that time, Craig was quite short of breath and needed oxygen to support his breathing. And there were trying to source the cause of his shortness of breath. He went for chest x-ray, couldn't find no cause, but that was the day, as it found out that the cryptococcus infection was going about, and my concern was Craig was in isolation during this period of time. Was he subject to the same infection because he was short of breath and they could find no cause? And that afternoon, literally, he was safer to go home, and we took him home.
Okay, moving on to a different topic. I want to ask you some questions about communication with the health board, or rather communication by the health board or by the hospital with you and with parents generally. I mean, just stepping back a bit, how would you assess the effectiveness of the communication by the hospital with parents in relation to the problems that there appeared to be with the hospital building?
There was no communication, and if it was always directed through the medical and nursing staff, which is completely inappropriate. It's not their job role, it's not their aspect to do, and they often quite hid away and weren't transparent, I feel, and it put the clinicians and the nursing staff in a difficult position because they're the ones that are facing the consequences of what burying their head in the sand and not dealing with things at the time when it should have been dealt with.
Now, you mentioned that there are a couple of Facebook groups that have been set up to maybe assist with communication. I think there's a parents one and there's a parents and a staff one, is that right?
Yeah, I think that's...
Can you tell us a wee bit about those and also whether you think those are helpful?
Of some line of communication with the parents.
You also mentioned that a man called Professor Cudahy has provided assistance in relation to contact between parents and patients and the health board, is that right?
Yeah, yeah.
And is that something that you found quite useful?
I do think that it's been extremely useful. It gives one single person one point of contact and able to kind of vocalise and air what our concerns have been and take things forward.
Now, moving on then to another aspect of communication, you indicate that you were at a meeting with the then Health Secretary, Ian Freeman, in September 2019. I wonder if you recall anything particular about that meeting that you would like to share with us.
I was quite angered by the Health Minister when she was talking about the duty of candour and saying that the medical staff and the nursing staff had their duty of candour to divulge what was going on in the ward in the hospital at that time. I had to disagree with her. I think because as a professional myself, you know, you'd have a concern of saying the place is not working or there's these issues going on because you'd be known as a whistleblower. It would have an impact on your employment.
So what was she saying about that matter?
She said that the medical staff and the nursing staff were free to have the duty of candour, that there was no underhandedness, they should have been open and transparent with the patients, and that was their decision not to do that.
And can you remember what the view of you and other parents was at the meeting as regards whether it appeared to you that the health staff had a free hand to say what they wanted to say?
I can't speak for other parents, but I know certainly from my perspective, the nursing staff and the medical staff probably were not able to be open and honest and say. I don't know if maybe my consultant was a bit more open with me, because I would have probably asked the questions as to why is he on this, why is he on that, and she felt that she was able to either try and say what was happening without going across to being open and honest with what actually was really going on.
Now, I want to ask you about something else now. In your statement, you indicate that son was part of something we know as the case note review, is that right?
Yes.
And did that help you understand some of what you had seen happening during your son's treatment?
Yes.
I mean, do you want to tell us a wee bit more about that?
Yeah, so again, going back to the original meeting I had with Therese Inkster and Jamie Redfern, and I found out Craig had stenophylmonas, I had asked if they could sample his specific infection and see if they could cross that with the hospital or home, because I was under the impression it could have been at the hospital, or he could have caught the infection at home. So I was kind of hopeful that they would have had some result or reference to that. At the case note review, they had said that he was probably, his infection was linked to the hospital environment and not, well, they just said it was probable because of the sheer numbers at the time that he got the case note, and it had had a significant impact on his treatment at the hospital and his outcome for his treatment and his completion of his leukemia.
And just thinking about another aspect of what you say about the case note review, did it help you understand perhaps why the hospital either did not or was unable to tell you more about where the infection come from?
In terms of why they weren't as honest or open?
Well, I mean, did it give you any indication about the extent, for example, as to whether there had been testing for the infection or the bacteria that was involved in your son's infection?
Yeah, well, I was under the impression that I would have thought with the outbreak that Craig was involved in that they would have been taking, you know, quite a lot of samples and detailing at the time, place, where it was found, the subtype of infection. From the case note review, I was quite shocked to hear that actual fact there was no testing done, and if there was testing done, there was no indication of where the test samples were received, what time they were received at, or even if they were in the same year.
Yeah.
There was no kind of transparency or recollection of when.
Yeah, I mean, I think you've already told us that at the first meeting, the one in early September, that Dr. Inkster had essentially said that she thought the infection had come from the hospital. Is that right?
Yeah.
I think you also say, and it's at paragraph 64 for those who want the reference, that you've subsequently seen your son's medical records, and in fact, you indicate that there's a report that indicated that they didn't think it had come from the hospital. Is that right?
Yeah, it just says not isolated, which means it's probably never been isolated from the hospital environment.
And do you understand now from what the case note review has said what that phrase "not isolated" meant?
Yeah, they weren't testing.
Yeah. Not isolated indicates an absence of testing, or that there's tests not available or something of that nature. Is that right?
There's no evidence to say it was there or not there, because they never did the testing.
I want to move on then and just think about one or two matters just to move towards the conclusion of your evidence, Mrs. Gallagher. The first thing I want to ask about is about the impacts on your son from all of this, and I'm thinking in particular about the impact of the steno infection. How would you describe that impact?
We were fortunate that Craig's donor was able to go along with the changes to his schedule. It was happy to delay treatment and give Craig the best chance, because the donation that he received was like the best sampling that he could get. So they did a bone marrow aspirate, you know, they went through quite a lot of suffering to get Craig where he is today. And we were fortunate that his donor was able to go along with him and support him with that.
Yeah.
With the stenophotrophomonas, Craig had still had that in his line when he went for transplant. Then we ultimately know what the consequence would that have been, and he would not have been here today if it had been allowed to continue, or if they never found that out.
And in addition to that, are we right in understanding that he also, son went through two lots of surgery as a result of the infection?
Yeah, he actually went through 3.
Right.
So he went through his appendectomy, then went through surgery to remove the line, and then had to go back into surgery again to get a line placed.
Yeah. And what about Craig during all of that? I mean, was Craig aware of all of this, and was he concerned, for example, about postponement of transplant?
Craig was aware of his diagnosis. We couldn't do anything to him unless he knew what was happening. He ultimately knew the consequences of him not getting treatment, or if he got an infection, he knew that he could potentially die. So yeah, we really cutely tell him when he had the line infection. We just told it was appendicitis, and you know, he wasn't fully aware of that side of things, but he was aware of the consequences.
I want to move on now, Mrs. Gallagher, and have you think a bit about the impacts on you of these issues. I mean, what was the impact on you on seeing him go through going through the line infection and everything that he went through in relation to that?
Well, to be fair, I probably have a lot of anxiety and mistrust in some of the, well, definitely mistrust in the health board. But it's watching your son suffer and you can't do anything to help them. And he's caught an infection that you're trying your hardest to protect him from. You're doing all your best, and you put him to a place where you think he should be safe. Because he was isolating for weeks on end in a hospital room with no contact with anybody. And you've put him in that place thinking he's safe.
I mean, again, if I can ask you sort of to step back a bit and just think about the whole period that your son was in the hospital. Did you have an awareness over that period of discussion in the media about issues to do with the hospital?
Not until the latter end.
Latter end. I mean, for example, you've indicated to us one thing that you found out through the media was about the move, about the closure of Ward 2A, is that right?
Yeah, it was always done through the public media.
And you found out about other things towards the end, is that right? I mean, how did it make you feel to be finding out things from media rather than from, say, the hospital?
I suppose you can find it hard to, it's just the lack of transparency. They're not honest, untrustworthy and underhanded how they handled the whole situation. If they were upfront and honest, you know, if there was an issue, we would never have shouted or been upset with them, you know, right, that's a challenge, what can we do to make it better? What can we do to fix it? It's not about burying our head in the sand.
And how do you feel about the fact that your son went through surgery, as you say, 3 times because of an infection, maybe linked to the hospital?
Angry. Should have been in there in a place of safety. They were supposed to look after him. I feel bad because we had to put him through that. And I had unnecessary risks due to another general anaesthetic, more pain and time away from his sister at home, because essentially that would have been his recovery time where we could have made memories.
Yeah.
That could have potentially been his last memories we could have made. But he was stuck in a hospital or going back and forward, trying to protect him.
Moving on now, just to really have you give us your concluding reflections, and you've done that in your statement, beginning at paragraph 134. I'm not going to have you read all of that out just now, Gallagher, but I wonder if you could have a look at paragraph 138. Say a number of things, particularly about the clinical team. I wonder maybe if you just want to read paragraph 138 to us, read it quite slowly.
Yeah. I think it's time that someone answered for what was happening. I think Professor Gibson and her team have taken quite a lot of flack unnecessarily when all they've ever tried to do is their best for the kids. That's ultimately what they've ever tried to do. Even if they gave treatment that wasn't necessary in some parents' eyes, it was about maintaining the kid's life and giving them the best chance. So hats off to Professor Gibson's team for what they did try to do. It's not a reflection on them.
Thank you. But what about the hospital? And how do you feel about the problems that you experienced and were aware of at the hospital?
I don't want to be there. I don't feel safe. I still, weirdly enough, love the place because I still have my son, but every time you go there, you just don't feel you're just wondering what you're actually going to come back with, or is there a risk they being back in there? So if anything, we try to avoid it and keep contact to a minimum, my clinic days.
Is there anything else you want to say before you conclude your evidence today, Mrs. Gallagher?
Obviously, Craig is aware of this situation. He knows about the inquiry, and he was very keen to have his say at the inquiry, but he's aware that he's too young and probably would be here forever. But he did want me to say, he had said, "Mum, please let them know that it's not the doctors or nurses' fault. It's the hospital that's sick, not them. It's the doctors and nurses that should have, you know, that it's not them. It's not their fault."
Thank you, Mrs. Gallagher. Lord, those are all the questions for Mrs. Gallagher.
Thank you very much, Mrs. Gallagher. Thank you for giving the statement. Thank you for coming and answering questions. That's now the end of your evidence, and you're free to go. Thank you very much. Now, Mr. Duncan, the timetabling would have, I think, Mr. Gallagher at 2 o'clock. Do you want just to stick with that?
I think that might be best, my lord.
Right. Well, we'll rise and we'll sit again at 2.